And good morning, good afternoon, good evening to all the participants from various time zones around the globe. My name is Deborah Shmueli, and I really want to welcome you to the third session of the workshop on mobilization, interaction, and contention, relations between NGOs, civil society, and states in times of COVID-19. The workshop sponsored by the Heiss Center for German and European Studies, the Minerva Center for the Rule of Law Under Extreme Conditions, and the National Knowledge and Research Center for Emergency Readiness. So our panel today is entitled State Regulation During COVID-19, Macro Perspectives, and we have 4 speakers and a participant and a discussant. I'm going to ask each of the speakers to briefly introduce themselves before their presentation. Each speaker will have approximately 15 minutes to present, leaving time for our discussant and subsequent discussion and questions and answers among all of the participants. So we'll begin with Katharina Konarek, one of the workshop's organizers and wonderful facilitators. Katharina will speak about COVID-19 and European solidarity, a make it or break it moment for the European Union. Katharina.
Thank you very much, Deborah, for the nice introduction. Also, I'm very happy to have you all, also on the second day. Let me share my presentation. Can you see everything? Yeah, perfect. So my name is Katharina Konarek. I am I'm the academic coordinator actually of the Heiss Center for German European Studies. I'm also kind of part of the Minerva Center. I often come and we work on stuff together like this conference. I'm by training a political scientist on the way to complete my PhD, and my field is German foreign policy. And I'm normally working on the German political foundations, but due to the current pandemic, I shifted a bit into already what could be my postdoc project, namely working on what is European solidarity in times of crisis, namely here under COVID-19. So what I want to do today, and Deborah, you already introduced it very nicely, I will try to debate what did COVID-19 do to European solidarity. Did it push it forward? Is it a make it moment, or did it like kind of crush the network of European solidarity? So is it a break it moment? So I will try to be brief, and what I want to present you is first 2 quick definitions of what I understand under solidarity, and especially European solidarity. And then I'm working with a survey called the Transnational European Solidarity Survey that evaluated European citizens, asking them what they think is for them solidarity on a European level. I will introduce the survey to you briefly, and out of this you can eliminate 4, or I will talk about 3 dimensions, so we will keep it timely. And then try to see if the pandemic is a stress test for this. So it fits very much in our conference theme. I think that we talked on the first day more on like specific country studies, and now we are opening up. So bear this in mind. This is a study that goes through the whole European Union. I think that will fit in quite well. Okay, so the genesis. Why do we came up with this idea, or why should we talk about solidarity when we are looking into the European Union? So I have here a quote from Robert Schuman, who was the French foreign minister in 1951, pushing towards founding the European Union. And he really stated that this idea or this concept what they have of a united Europe after World War II, it's nothing that can come just in one day, and it cannot just be made by politicians on a political level, but it has to come through concrete achievements. And these achievements will just create step by step a de facto solidarity. So this is kind of the background why we're looking into the solidarity issue. And as kind of a definition that is also used in the survey that I will present to you, it can be defined within basically 3 points. Dr. Lahusen is the one who conducted the study, mainly a sociologist from Germany. And he would stress out that under solidarity, in the sense, we're looking into mutual help and support that can come by single persons or individuals, but also by groups. And this help is also based on joint norms, which is very important, this is, you have it here in the second point, that we have joint norms, expectation and practices on which our mutual help and support is carried out. And in a third point, also that the solidarity normally has kind of reference groups. So if you feel that you are a member of a group or a membership, this is where you feel that you can help someone, or like in the sense of the European Union, for example, to help another state or another country. We have also to be very clear when we're talking about European solidarity. What is it? It doesn't mean Europe as a geopolitical point, but it means a political entity, namely the European Union. And here, if we come to this, we even can see that solidarity is very clearly also regulated in the contracts. We have mainly two contracts or treaties that were like designed in the European Union that really also mention the word solidarity. And this is the first treaty, is the one from 2007, the Treaty of Lisbon, that says very clearly, and it is still a shell, the European Union should promote economic, social, and territorial cohesion and solidarity among member states. Again, it's a shell that's very typical for the European Union, but it is at least mentioned and even stated as a word. And it becomes a little bit more concrete in the Treaty of on the European Union in 2012, where it says solidarity, or to deepen the solidarity, especially between the people, is something that should be desired. So keeping this in mind, I want to introduce you this so-called Transnational European Solidarity Survey. It was a study conducted by a group of German political scientists and sociologists in 2016. And the research question was quite straight to the point. So they wanted to know how strong is the solidarity in the European Union among the people, among its citizens. Hypothesis number one was that it cannot be enough that people are supporting solidarity among member states in the European Union, but they need really to be in favor for it. They need really actively to state, yes, we prefer like a strong solidarity in Europe. And the second one is there's, of course, a relation between national and global solidarity that we have to take under consideration. The survey was conducted in interviews over the phone, and they were mainly conducted in summer and fall of 2016. It took about 30 minutes, and you see we have a group here of 12,500 people that answered, and about 1,000 people per country. And it was just conducted in 13 EU member states in order to kind of make it a feasible study. I listed also these countries here, and the countries were selected also by criteria like economical status of the country, when did these countries join the European Union, so to have kind of a good balance. I want to show you briefly how the questions were asked, so you have an understanding of it. So it went all the time from 1, which is like totally agree, to 4, totally disagree, or you could also say, I don't know. And the questions were really presented on either a national level or a European level, asking also, like having, not asking questions, but having very concrete statements. For example, if we take the first statement from the question 1A, and now conducted to Germany, the question would be, the German, and I read from here, the German government should guarantee access to health care for everyone in Germany. So do you totally agree? Do you totally disagree? That would you could choose. And then the same question would be taken also to a European level, to say the European Union or the European Union government should guarantee access to health care for all European citizens. So this is an example for the question. This is an example for how the outline then looked. So you would find basically two results, one on a nation level and one on a level of the European Union, and always with a tendency either to agree or to disagree. So to the findings and why I think they are quite interesting also for us today. So this group of researchers identified 3 different domains where European solidarity can or could be shown in the past. So once was the physical solidarity in 2008 with the financial crisis. That also goes hand in hand with the welfare state solidarity in 2009. And of course, in 2015, the refugee crisis, showing solidarity here. And the results were like first the physical solidarity, where like we are dealing with the financial crisis and the question, should the European Union help its member states, for example, with a mechanism, a stability mechanism that we have here, to give member states loans in order to have a stabilized Eurozone. The respondents from the people that were asked was quite surprising also for the researchers. Namely, 2/3 of the respondents agreed that such physical support should be given within the European member states. And a clear majority even agreed to have their own small taxation on their income in order to contribute to the European Solidarity Fund. So this is quite interesting because if you would have talked before with politicians on the level of the European Union, you would have get more an answer that they would say, well, we cannot decide anything against the citizens. Citizens would be protective towards their own state, and they would not be willing to give money into such a big pot or fund. But on a citizen level, you get a very different answer. So it can be kind of connected to the fact that most of the European member states are using the same currency. So the people understand if one country is going down, for example, Greece, it will affect also other countries. But this was the respondents in 2016. Very similar to this, also the welfare solidarity. It is connected to the high recession that followed after 2009, after the financial crisis, and that there was a big gap in European member states, also between poorer and richer countries. So the European Union kind of developed a plan called the European Social Security Fund that would fight unemployment, sickness, or poverty of elderly people in the whole European Union. And also here, an overwhelming majority of respondents reacted very positive and said, we need this solidarity and we need to redistribute. This also the researchers brought maybe in kind of context with the open borders that we have in the European Union, saying like, okay, if someone, for example, in Romania, a state that was really also affected by this recession, couldn't have a job, they would come to Germany or to Austria and work there because this is possible in the European Union. But still, there was this very big agreeing on that we have to help each other also on a level of social security and welfare. The picture turned a bit different when asked about the refugee crisis or refugee solidarity. Just as a reminder, we're talking here about the influx of refugees mainly from Syria, Iraq, and Afghanistan to the European Union. So here we had like 2 big questions, like should Europe grant asylum and are Europeans willing to share the costs? And here the respondents split the first time, namely respondents from Eastern European countries were much more like hesitant towards it, whereas a majority of respondents from countries that have been longer in the EU, like or Central European countries, have agreed much more on this. Here, maybe you see the first time also the division of kind of wealth in the European states to say, okay, countries that are less wealthy really fear of this influx of refugees or people that come and might endanger their positions in the country. Overall, as a summary, it was much more positive than, the results were much more positive than expected. It showed a very high level of European solidarity among the citizens, much higher than political decisions makers would say, and also that the observers basically expected. And there is a big level of support also for this idea to protect EU citizens from risks. What you can also see is that the crisis, the financial crisis, especially pushed more a social dimension of European integration and brought people closer together. And this was also a surprising finding. Okay, so knowing all this as kind of a background, what do we see when we look into the current pandemic? So we can see it as a kind of stress test, especially for European solidarity. So the first response was basically very poor. The European member states, if you remember this, in March 2020, withdraw behind their national borders. It was the first time that borders within the European Union got closed, and actually also against the Schengen Agreement. And countries that were hit very badly in the first wave of the pandemic, namely France and Italy, didn't find immediate help in the European Union and with other European member states. They really asked and out for it, and the European Union and the European member states were very hesitant to share like equipment or take patients from these countries. So they started to reach out, for example, to China or to other countries. So here you can really also see, and this is the third point, the lack in this current stage of common health policy. It's very similar to the refugee crisis in 2015, that there was also no common foreign policy, but this really was a very heavy toll on the European Union in the beginning of 2020. In the summer, in 2020, it started to change. The European Commission, this is the one basically, you have it here, functioning as a European government, so to say, purchased 800 million doses of the vaccine from different countries. They established this European Center for Disease Prevention and Control, and also put a lot of money into it, increased its budget. They decided on a distribution plan for the vaccine. This was heavily criticized within the member states itself, but this is something that everybody kind of obeyed to, like to say, okay, we're going to distribute it together. And also the European Union became part of the COVAX facility to say, okay, we need to see this as a global crisis and a global pandemic, and also help other states outside of the EU. Austria and Denmark, though, took a little bit a special way, especially for the Israeli audience. You might know that they tried to tie up with Israel and develop their own vaccine line, but didn't really work out. So let's say by the summer, the European Union started to manage much better with the pandemic, also and to help each other. So what you can see as kind of predictions, and that brings me also almost to the end, out of the study that I presented you today, the researchers developed a so-called European Solidarity Tracker that gives you much more up-to-date data, let's say every half a year. And you can see out of this data also regarding the crisis is that still the gap between European countries in the north and the south has enlarged during the pandemic and is enlarging still. But what was kind of a make it moment for the European Union is the perception of the pandemic as a global event, to say, okay, this is something we cannot fight alone as each member state by its own, but this needs really the solidarity that we already practiced before as welfare solidarity or physical solidarity during the financial crisis. So this really pushed it much more forward. And this would be also my conclusion. And of course, we have to follow up with much more research. But in general, moments of crisis seemed really to strengthen European solidarity. And when the pandemic hit Europe or the European Union, it hits it on a very high level, because we were already after the financial crisis and also after the refugee crisis that the European Union, at least in the perception of the citizens, seem to have managed quite well. Very interesting, I think, is also this big mismatch between how the European citizens feel about European solidarity and the political decision makers. So if I would be supposed to write a policy paper, this would something to stress it out and to say, European citizens want more solidarity and they want more Europe. So this is something political actors should follow up on. And it goes together that European integration, a civic label, is much more advanced than on an institutional level, that we still lack, of course, a common health policy, a common foreign policy. But if we really pay attention to the surveys, this is something that people want and that the politician makers should kind of conduct. Okay, so this is it from my side. Thank you very much, and I'm looking forward for the other speakers.
Really fascinating. Thank you, and we'll hold the discussion until after everybody's spoken. Our next speaker is Anthony DeMatte. He will talk on civil society laws in East Africa, a comparative and institutional analysis, and a gentle reminder to begin with a few words about yourself. Thanks.
Yeah, great. Thank you, everybody. My name is Anthony DeMattee. I'm an NSF-funded postdoc at Emory University here in Atlanta, same town as our discussant, Amanda, who's putting forth some great work reviewing our papers, so thank you for that. I'm really excited to be a part of this panel. This research in general, as far as what this conference is about, and especially this panel, directly kind of overlaps with my research interests, both short-term and long-term. So it's great to be here. I'm especially interested in the relationship between state and society, or civil society, with a particular interest on the global South. My research focuses on East Africa and also the Caribbean. And I am quite fond of institutional analysis. So this paper and the presentation that I'm going to give is kind of heavy in that institutional approach, but also policy and policy diffusion. So with that, I'll go ahead and get started. So the general topic is this idea between the state and society and the relationship that they have over time. I am not one to think that civil society organizations are angels from heaven. I generally think that civil society is great and civil society organizations are a positive force. I don't think all of them are fantastic, though. And that's because I have a very broad definition of what civil society organizations are. But in general, civil society is good, right? It helps with democratization. It prevents democratic backsliding. Like, these are good things. And it doesn't take too much of an imagination to imagine that if a government or a regime wants to consolidate and autocratize, one way to go about doing that is to eliminate these popular threats. So this is where this very popular research program comes in about governments taking hostile actions towards civil society. And that's something that's been very interesting to me. And it's becoming increasingly important, right? There are now more autocracies in the world than there are democracies, and those autocracies govern over 2/3 of the world's population. So this is kind of a big deal, right? So the paper focuses on how these laws develop over time. And I take a very historical approach to this. I focused on East Africa, and I actually look at the development of laws in East Africa over a 55-year period, which for East African countries is their entire independence. This presentation, though, to kind of keep with the theme of the panel, focuses on the 12 months in 2020, in which governments took actions to control the pandemic. That could be interpreted as a kind of a never letting an opportunity go to waste, right? And passing these emergency declarations and emergency provisions to further restrict civil society with the guise of, protecting public health. My partner, by the way, works for the CDC, so this is an interesting conversation in our household. So when it comes to this, state-society relationships and the legal institutions that they erect and enforce over time, what we know is kind of comes from what we've studied. And we can interpret these as either facts or myths or paradigms or whatever you choose, however much you want to believe in them. But generally speaking, researchers conceptualize these things as recent, discrete, and homogeneous changes to a policy domain that before a law was passed, it was empty, right? It was just kind of this blank slate, and governments decided to erect a law. Oftentimes, research talks about these laws as being unidirectional and permanent. Like, once they're in the field, they're there forever. and that they don't change very much. And most of our research is focused on low and middle income countries and non-democratic societies. So we're kind of skewed a little bit that way as far as what we know as well. Research has also tended to focus on domestic explanations. We can call those like contemporary political factors. And I think that's true. I think there's a lot of political motivation behind this. But there's also really good reason to believe that some of these laws are actually adopted because of international influence, either because governments learn from each other or seek to emulate each other. What research doesn't necessarily consider is pre-existing institutions. We can think of these as laws that exist on the books before other ones come along. We can also think of things that are more important than laws, constitutions, international treaties that kind of constrain and incentivize political actors, right? So these are a list of tactics that governments can use to either restrict or manipulate or control or partner with civil society organizations. These can be a mix of de facto or de jure types of tactics. The one that I'm focusing on in this presentation is on the bottom, using the pandemic as an excuse to enact more provisions, but the paper focuses on de jure laws in general, like de jure rules. So the data for this presentation, which is a robustness check in the paper, comes from the ICNL-ECNL COVID-19 Civic Freedom Monitor. If you haven't seen this, like, check it out. This is awesome. And ICNL and ECNL are both excellent organizations that have done a really great job of identifying these types of laws that exist in different countries and how they affect civil society, the freedom of assembly, freedom of association. And through a crowdsourcing type of effort, they've created this list of executive actions that governments have taken during COVID to restrict the civic space. So I was thankful that I was able to, kind of get this data under control in time for this presentation. So this could be a story of two pandemics, right? If on the one hand, governments are restricting civil society, that's a big problem. And this could be considered a pandemic itself. And then when it's happening in 2020 during COVID-19, this is also a pandemic, right? So in March of 2020, and that's what that vertical line at 3 represents, we saw a huge number of countries enacting these types of restrictions, right? Over 250. So that automatically tells us, like, maybe there was something around there. In March of 2020, that's when the World Health Organization came out and started making, really getting serious about how bad the pandemic was. That's when the United States kind of made this turn to, kind of closing down kind of our public spaces. And then the dashed lines represent the growth of cases and also deaths inside the US. What's concerning, though, is what happens in like May and then afterwards. We still have, on average, nearly 20 countries every month enacting these new types of provisions or laws or restrictions or emergency declarations. And we get to see kind of, how governments are possibly taking advantage of an opportunity, or maybe they're just taking more precautions to protect COVID, right? So as I said, constitutions, policy diffusion, and is this a story of kind of autocratic learning, right? So constitutions are important, not just because they define executive power and give us our civil, the civil rights that we have, but they structure rulemaking, right? They tell us like what it takes to overcome an executive veto. When do governments meet, and how does the legislative process actually work? Can the executive actually declare emergency proclamations or emergencies? Can those types of rules. Internationally, the ICCPR, which I imagine a lot of people in this room know about, is a huge pillar, is a massive pillar for international human rights when it comes to this freedom of association. And Article 22.2 stipulates this 3-part test that legislation must follow in order for it to be seen as reasonable, right? But so this means 2 things. The ICCPR doesn't affect people in countries that don't ratify it. So that's one. And even countries that do, we might not see its strength as important across the table because constitutional rules will throttle how important international treaties and international agreements are. So there are stipulations in constitutions that give international treaties and agreements actually making them superior to ordinary legislation or inferior to it. So if you ratify the ICCPR, but your constitution says that it doesn't matter, it's not that much of a constraint as far as compared to a country that ratifies and has constitutional rules elevating that pre-existing commitment above ordinary legislation. So that's one of the things that I test in this paper, and in this use of like COVID protocols. So the other bit that I test in this paper is diffusion. And this is the process of government-to-government learning, right, or emulation. This can be thought of as either the logic of like consequentiality. So whether it's this rational approach to lawmaking, is country A, the law that they have or the policy that they're enforcing, does it produce the outcomes that I want in my own country? Because if so, like bring it on over, let's adopt that. The logic of appropriateness is different. That's more about mimicry or emulation. And that's if this strong country is passing these laws and I want to emulate that strong country, I don't necessarily care what the law is doing or what the policy is doing. I just want to, emulate that country. So I'm going to adopt the same law, maybe for ulterior motives, right? So that's the difference in a couple of the different mechanisms in policy diffusion. Diffusion is oftentimes studied as binary events. Do they adopt a policy? Do they enter a treaty? So on and so forth. It's less common, but entirely appropriate to think of these things as bundles of rules. So we can think of a constitution. Constitutions vary across countries for sure. We can think of them as bundles of rules. How many powers does the Constitution give an executive? How many freedoms does a Constitution give its people, right? A law is the same. It's a bundle of rules. And when a diffusion happens, when we think in terms of bundles of rules, it's taking more steps towards the leaders than you're taking away from it. So this is kind of diffusion emphasizing both direction and magnitude. So the hypotheses I'm testing in this paper are listed here. They're explained a little bit more. They're explained a lot more in the paper. But generally, it's this hypothesis one is this biconditional institutional arrangement in which if a country has ratified the ICCPR, that ratification is a stronger constraint if the Constitution makes that treaty commitment superior to ordinary legislation. It's a very simple, but I think pretty powerful institutional argument there, right? And then I test this alongside a couple of the different mechanisms of policy diffusion. Hypotheses 2 and 3 are about learning. Are you learning from autocrats, or are you trying to learn from liberal societies that have a really positive state-society relationship? And then hypotheses 4 and 5 are about emulation. Are you emulating the big kids on the block, which are the permanent members of the UN Security Council? Or are you trying to emulate other countries that have a common colonial history as you? So those are just a couple of the hypotheses that I have. So the data comes from that Civic Freedom Monitor. I transform all of that into country months. So we can think of a data set that's a global data set that's 12 months long, right? So to rigorously test this diffusion stuff, you have to transform this country month data set into what's called a directed dyad month data set. So this is essentially close to a network analysis where leaders are countries who haven't adopted a policy, so who haven't enacted a COVID protocol. Those are laggards. Leaders are those who have. So the first countries out of the gate who start enacting these things become the leaders. And then other countries will either learn from or try to emulate those countries. And the mechanisms that are theoretically motivated are the learning or the emulation. So we have the dyads, and so the data set get big quick. So in order to account for these directed dyads, which are on the very bottom, which have many, many connections, there's over 11,000 directed dyads. We use a multi-level model on this so that the constitution things, which are all the dyads nest within a country, just to separate the variation on there. Otherwise, standard errors get really small really quickly. So these are the outcomes. So whether a country enacted any response, whether they enacted a decree, which is a type of order or emergency declaration, or they actually went through a legislative process. To enact a law during COVID. The constitutional rules are straightforward, and then the learning mechanisms are relatively straightforward. So this is a simple linear probability model. Some things, a lot of the controls are omitted. It is a multi-level model. So right here, what we see is once we start to understand some of the differences in the outcomes, whether we're looking at are they enacting anything versus a simple decree or a longer law, what happens? So we see that these factors vary once we start to consider the types of legislation or actions governments are taking. But we can look at graphs for a better understanding here. So this is the effect of the ICCPR ratification on the probability that a government enacts one of these responses. On the left side is constitutional rules, or is a lack of constitutional rules making that ICCPR superior to ordinary legislation. And then on the right side is when it is superior. So we see that the ICCPR doesn't have the predicted effect that we would expect unless we start to incorporate these constitutional rules. So the ICCPR plus constitutional rules that elevated above ordinary legislation really weaken the probability that a country adopts one of these restrictive policies. And in comparison to some of the other factors that we have going on, so the solid graphs, the solid items here represent the presence of this condition. So if the leader is an autocratizing society, we see a decrease in the probability that the laggard government enacts one of these emergency provisions, but it's a very small effect. The same thing can be said for whether the leader is a permanent member of the UN Security Council. It makes it less likely that others follow, but it's a very small effect. And then the constitutional rules, pretty powerful stuff relative to the diffusion effects. And we can be pretty confident about the effect sizes here because of that multi-level model. We're not oversampling the constitutional rules here. So there is a little bit of this learning and emulation happening, but it's not a very strong effect relative to the constitutional rules. So I'll just go ahead and conclude with kind of some extensions to this in the paper. The laws in East Africa have been developing since independence. A lot of the laws in East Africa that regulate civil society were actually inherited from colonial powers. So in Kenya, it's the British. In Tanzania, it's the British, and so on and so forth. And none of these laws are strictly prohibitive. They actually have some good things in them. They have a lot of good things, and they vary over time quite frequently. So we know that they're not permanent. So this is challenging a lot of the research that exists currently that really starts to pick up in the 1990s is where their analytical lens kind of begins. But going back to independence and what laws existed at that time is really important. So I'll go ahead and conclude with that and just be prepared to answer any questions that come up later. And thanks to everybody else.
Another really fascinating presentation. Many thanks, and waiting for the question and answers. Our last presenters, Suparna, Chaudhry, and Andrew Heiss will be talking about derogations and democratic backsliding, exploring the pandemic's effect on civic spaces.
All right, so I'm happy to be here. Suparna sends her regrets. She's in Portland where it's 115 degrees right now, and so they're having intermittent brownouts, and so she can't be here. But I'm happy to be here. I'm Andrew Heiss. I'm at Georgia State University, also in Atlanta, like Amanda and Anthony. So our project with Suparna and I, we've been long interested in civil society regulations across the world, but especially in authoritarian regimes, which goes nicely with what Anthony's been doing. I've followed Anthony's stuff for a long time. He's a great guy. This is a great panel. So what we're interested now in is, because of the pandemic, we want to know if there's a relationship between civil society restrictions and COVID emergency measures, similar to what Anthony was asking as well. And so what we attempted to do in this paper, and this is also kind of early stages, we're still collecting data, is trying to see if formal declarations of emergencies because of the pandemic help either protect against democratic backsliding and additional restrictions on civil society, or make it worse. And so the main mechanism we're looking at in this paper here is this idea of derogations. from international treaties, which Anthony mentioned. International treaties like the ICCPR, that's our main focus in this paper. And so we'll talk briefly about what derogations are and why we care about those and how they're related to civil society regulations. So plan for the next 15 minutes or so. We'll talk briefly about derogations and the pandemic. Then we'll talk about the data that we are using and the data that we've collected. And then we'll explore this data that we've found and that we've used to see what the relationship is between emergency measures that governments have enacted and human rights in those countries. Then we'll look at the relationship between derogations of international treaties and human rights. And then we'll conclude with some hopeful future avenues for research that we're potentially going to look at. So in general, this idea of derogations in international law is kind of an escape hatch that countries can rely on when they sign up for an international human rights treaty. And so international treaties like the ICCPR and most other broad international human rights treaties allow states to temporarily suspend their treaty obligations in times of emergency. So they can deal with the emergencies at a domestic level, and then they can go back to respecting human rights. It's kind of the rationale behind this. Not all human rights are derogable or suspendable. You can't suspend the right to life or freedom from torture, slavery, other things like that. Those are all like hard, long-standing human rights. You can't give those up during an emergency. So that's what derogations are in general. The reason this is important is because during a pandemic, because of global health concerns, there are all sorts of needs to curtail human rights for the sake of public health, restricting freedom of movement, restricting freedom of association, tracking people through contact tracing, other issues that come up in the service of trying to curtail a pandemic. And so, as Anthony mentioned, the ICNL has been tracking kind of restrictions on civic space and on civic freedoms. So there's this civic freedom tracker. He had the URL in his presentation. If you just Google this, you'll also find it. So it shows a list of all the different countries that have formally declared public health emergencies and have implemented different types of emergency measures. The way this works is if you're a country who has signed up for the ICCPR or any other international treaty, you have to go through a specific process to derogate. And what this generally looks like is the country at a domestic level declares some sort of national emergency. They notify the UN treaty body in writing. Generally, an ambassador to the UN fills out a piece of paper and says, we're going to declare an emergency. We're going to derogate from these specific rights. As part of that declaration process, they have to prove that the derogations are temporary, necessary, and proportional. And then they kind of have to explain how that is. And they have to justify why they are doing the different measures that they're engaging in. And then finally, they have to provide a sunset clause or kind of an expiration date for the derogations. And that's the general process. It's kind of a long process. And as we'll see, lots of countries don't go through this because it is kind of a more involved, formalized process. And so what we're interested in is if countries go through this process, does it do anything? Does it help protect human rights? And that's kind of the goal for having this escape hatch in general. So our general questions here are mostly descriptive at this point. We want to know how many countries actually went through this process during the pandemic and derogated their treaty obligations. Then we're interested in how those emergency measures in general have differed across countries in democracies and autocracies and different levels of democratized countries. And then finally, we want to see if these derogations kind of protect against civil society abuses and democratic backsliding, which is kind of the goal for these derogations in general, is to help prevent backsliding. So we want to see if that's actually working. The reason we care about this is, as we've mentioned, as people mentioned earlier in this presentation, in this panel, there's kind of this global crackdown on civil society that we've all been studying, looking at kind of the general curtailing of civic space around the world. This data here comes from Civicus, the global NGO law monitor, where they track how open or closed civil society is across the world. And as you can see here, most countries, I think it's only 3% of the population of the world lives in a society with completely open civic space. Most other countries have some sort of restrictions on civil society, ranging from just narrowing civic society to totally closed and highly restrictive spaces. And so with the pandemic, which has affected the entire globe, we want to see how that kind of interacts there. We're also interested in derogations in general because there's this broader literature on how states react with derogations. And there's a fear that states can often become serial derogators, where they'll curtail some rights for 6 months, and then a couple of days before the expiration of that derogation, they'll do another derogation. They'll just keep derogating over and over and over again so they can prolong a state of suspension of human rights. And we've seen this in a few cases, and we'll talk about a couple as we go through this presentation here. And there's also a fear that temporary measures that come because of public health interventions or any type of derogation can then lead to permanent changes in the human rights landscape in a country. And we've seen this throughout the pandemic so far. There's every month or so we get articles in the New York Times, Washington Post, and elsewhere saying that like these countries are cracking down on COVID-19, but they're also using that as an excuse to do further human rights crackdowns. And so we care about this because it could potentially be an excuse to further consolidate autocratic rule in some countries and to generally worsen the human rights, the respect for human rights in different countries. So the data that we look at for this project comes from two different sources. We use this really neat project that's a part of the Varieties of Democracy project called Pandem, or this pandemic backsliding index that VDEM has been collecting. It includes data for 144 different countries for 3 quarters of 2020. So they don't collect any data from like January to March because that was pre-global pandemic. But then they track every 3 months after that. And they collect a couple different indices about how severe the restrictions are, about how abusive they are, how respective the governments are about declaring formal emergencies and adhering to those emergency declarations and other things. It's a really rich data set. I encourage you all to go look at it. It's fantastic. So in addition to that, one thing that VDEM does not collect is whether or not countries officially derogated from their treaty obligations. And so we collected this data here. That we looked up all 173 signatory countries at ICCPR and then figured out if they derogated or not. It's a binary variable at this point because it's just a binary choice to derogate or not. So this is the data we rely on throughout this project here. The neat thing about the VDEM data, this pandemic backsliding data, is that they measure some sort of quality of derogation or quality of emergency measures. And so what we define as, or what the ICCPR defines as needing something to be temporary, proportional, and necessary, we rely on variables in the Varieties of Democracy data to qualify if a country has kind of this temporary, proportional, and necessary requirement. We count that as if the derogation has an end date, which it should, if the discriminatory measures that happen because of the derogation are not too bad, if there's no violation of non-derogable rights, and if abusive enforcement is rare. And in the paper, we go through more kind of quantitative details about what that means, but that's kind of what we're talking about here when we say that a derogation was kind of done well. This is what we're talking about. So let's look at some of this data and see some of the descriptive patterns that we can find because of this pandemic. So as far as countries officially declaring emergency responses because of the pandemic, we see that most did some sort of emergency response. And there's a relationship between emergency responses that they declared and different levels of democracy in the country. So if we look at this graph here, this top row shows, or the x-axis here is the liberal democracy index in VDEM. So 0 is like North Korea with no liberal democracy, and 1 is like Denmark. That's kind of the range here. And you can see that there's kind of a uniform distribution here of countries that used legal instruments to declare some sort of human rights emergency in their country. And that doesn't really vary. So the most democratic countries did some sort of formal declaration of emergency. The least democratic countries also did. Where we see some more variation here is when countries declared a response without legal instruments. There wasn't a formal declaration of emergency. They just started implementing emergency measures. And the countries that did that were overwhelmingly autocracies. No democracies kind of unilaterally declared public health emergencies in their countries. And then the no emergency response, that's just kind of an artifact of the data. China is one of them. Germany and Canada are these two over here, mostly because they just didn't check the one box that made it formal according to Readiness democracy here. So in general, you can kind of ignore that no emergency response because they're kind of exceptions to this. As far as looking at regime types here, again, this maps fairly well to what we saw with this liberal democracy index. Democracies are generally most likely to declare emergencies with legal instruments. Autocracies are not. The only democracy that declared an emergency without any formal official declaration was Sri Lanka. So we see there's a pretty strong relationship there between those two. As far as how bad or how discriminatory these measures were, we can see some patterns that generally make sense here. In countries that declared emergency responses using legal instruments, the discriminatory index, how incorrectly the measures were implemented, were lower than the countries that did it without legal instruments, which again makes sense. If you're going to follow a legal process, you're probably going to not discriminate as much as people who doing it extra legally. We also see this the same pattern with violations of non-derogable rights, so rights to freedom of religion, expression, other things like that. In countries that used legal instruments, there were far fewer violations of derogable rights than the countries that used legal instruments. The only surprising pattern that we found is right here with abusive enforcement of the regulations. We find that countries that used official legal instruments were more likely to abuse those regulations and kind of go beyond their legal mandate to do so, which is interesting because, again, in theory, the legal instruments should protect against that. Our only hypothesis here, our speculation, is that in part they can be more abusive because they have the legal backing to do it. In a country that announces some sort of emergency response without any legal backing, it's really hard to count any abuses of the emergency measure without having an official emergency measure to abuse. And so this might just be an artifact of the data that we find. As far as the relationship between pandemic violations and civic society space, we do see some sort of potential protective nature of civil society regulations. So we see that the y-axis here is the pandemic violations index, how badly a country violates human rights because of the pandemic. And the x-axis here shows the varieties of democracy core civil society index, so how well a country respects civil society in its country. 1 means it's great, everything's going smoothly. 0 means North Korea, or civil society is not allowed at all. And we do see kind of this negative relationship here. The more a country respects civil society, the less likely they are to violate human rights because of the pandemic. So that's kind of the descriptive relationship we see there. As far as the formal derogations, though, we see interesting stories here as well. So previously, all of this here with this legal instruments, that's all at a domestic level, where a country says we are declaring a public health emergency. These are the legal instruments we're using to do it, but they don't consult any international bodies to do that. That's where the derogations comes in. And so based on the list of 173 ICCPR signatories, only 23 countries formally went through the process of derogating from those treaty obligations. Most countries did not, either because it was onerous and you don't want to go through that long process, or as we'll see in the case of India, some countries were not allowed to go through the derogation process because their domestic constitutions didn't allow a formal declaration of emergency because of health. In some cases, you can only declare an emergency because of war or other types of conflict, but not public health. So as far as the countries who derogated as intended, we see a wide range of countries. We have like Kyrgyzstan, Namibia, Peru, Azerbaijan. There's not really a strong pattern there to which countries did it and which countries did not. You'll notice that there are like no Western European countries. The United States is not there. Canada is not there. Nobody really officially formally derogated. The countries that derogated but did it incorrectly and had measures that were not temporary, proportional, or necessary are generally in South America, with the exception of Armenia. But again, we don't know why those patterns are there. We're trying to explore that with this paper. To help explore that, we kind of created a typology here to see which countries derogated correctly or incorrectly. And we made this typology here of 4 different possible outcomes. And we see that there is a relationship here between countries who derogated correctly or not, and how abusive they were. So we combine our ICCPR data with the VDEM pandemic violations data. And you can see that there's kind of a relationship here, that countries that officially derogated had a lower level of general violations. Countries that did not derogate had generally a higher level of derogations. And that's the relationship that we would expect to see here. With civil society relationships, we see the same type of thing. Countries that derogated generally have stronger civil society. Countries that did not derogate, that relationship starts going negative and becomes weaker.
Andrew, sorry, it's really fascinating, but we have to leave some time for there are a lot of questions and
yeah. So
the discussant. Sorry.
Wrap this up. So based on those relationships, we generally find that all of these things are related, but we don't necessarily know how they're related. So our goal is to figure that out more. So we're planning on expanding the list of treaties, going beyond just the ICCPR to see if regional treaties are stronger than international ones. And then we're hoping to answer some longer term questions to see in the long term, do these derogations and do these human rights suspensions lead to more substantial democratic backsliding in the future?
Great.
And that's what we're kind of hoping to see. So thanks.
Fascinating. Looking forward to the paper. Okay, I really want to thank all of our speakers. And now I'd like to turn the session over to Dr. Amanda Reinke, who's our discussant today. Amanda is an assistant professor of conflict management at Kennesaw State University, we heard already, in Georgia, in the School of Conflict Management, Peace Building and Development. Amanda, why don't you take it from here? And if you want to also, there's a whole list of questions in the chat. So your prerogative.
Okay, well, thanks, Deborah. I appreciate it. And thanks to all of our panelists for your interesting papers. I really enjoyed reading them, and I appreciate getting them several days before today, so I had ample time to read them. Many thanks for that. All right, so Deborah introduced me, so I'll just skip ahead and I'll say that I'm going to start with comments for each of the individual papers, and then I'm going to thematically link them towards the end of my comments. And I promise that I will try to keep this as brief as possible so that we can get to the wonderful questions we have in the chat. For those of you who haven't been paying attention, who are an author, please do direct your attention to the chat questions, which are available to you. If you want to go ahead and start thinking about those while I'm kind of working through this content here. So building on work that examines the multifaceted dimensions of solidarity in the EU, beyond just legal obligations or political rhetoric, Konarek uses surveys to examine support for European solidarity amid crises. Findings demonstrate that respondents had high levels of support for solidarity. And data seem to show that crises, such as the influx of refugees, economic recession, and COVID-19, may strengthen solidarity on a number of its dimensions. I'm intrigued by the important distinction between citizens and residents' feelings about solidarity versus their political representatives and decision makers. How might we decipher these differences such that we can see the ways in which bureaucracy and institutions betray or align with their citizens' interests, beliefs, or values? And what do you see as the future of European solidarity? Given various crises that will continue to beset us globally, will the gap between North and South continue to grow, or will there be some amelioration of this gap? Contributing to literature analyzing government attack on and restrictions of civic spaces, and using an original data set of laws enacted by nation states, DeMatte demonstrates the ways in which governments adjust their restrictions on civil society incrementally and over time in ways that both add and remove restrictions. While international relations and domestic circumstances might shape CSO law changes, constitutional law tends to restrict some change and be an all-important factor. The nuanced approach to understanding CSO law and change over time, and in relation to both international and domestic factors, is particularly important and novel in this work. I'd be curious to hear your thoughts from a socio-legal perspective on the balance between public health, safety, or even national security, and the need for civil and political rights in particular amid COVID-19. And further, there was a little bit of a note in the paper that you made that you treat all CSO laws sort of equally weighted, choosing to focus on directionality instead. So I'm curious to know how you might address this weighting issue as the next sort of logical step in the research process. In their paper, Marciano presents a 4-point typology for how we can understand the role of consulting firms who stand at the juncture of public and private spheres and policy formulation, roles that vary both in terms of form and importance across the socio-political landscape according to jurisdictional norms and contexts. Marciano utilizes interviews with consultants and bureaucrats in the Ontario healthcare policy subsystem as a case study to formulate this theoretical framework for understanding how consultants and firms can be understood as active participants in policy processes, but with diverse roles, influence, and effects depending upon their positionality and jurisdiction. I find this really interesting, especially when I consider the ways in which consultants are somewhat freed from the many burdens of what we might call street-level bureaucrats, but are actually interacting with them on a regular basis. And one of the things I found challenging during COVID-19 was recruiting interview participants for my own research, and I'd be curious to hear you talk a little bit about perhaps some of the challenges you faced in that. And finally, in their paper, Chaudhry and Heiss examined measures for analyzing the relationship between COVID restrictions and civic space. During the pandemic, civic space has been limited, but this is a trend that predates the pandemic in many cases, forming a longer-term trend. And there's a clear link between civil society space and access to civil and political rights and pandemic measures, such as quality of derogation. I'd be curious to know to what extent we could begin to consider the measures utilized in this paper as mechanisms not just for understanding the past, so COVID-19 restrictions, for example, but also to begin thinking about the future likelihood that particular states are likely to commit extraordinary human rights abuses, violate treaty agreements, and/or limit civil society by claiming a state of emergency, either via lawful or extra-legal means. So, to kind of bring this all together for you here for a couple minutes, adding nuance to literatures on European solidarity, the relationship between the state and civil society organizations, the state and consulting firms, and state responses to crisis in ways that affect human rights, the authors on this panel utilize various methodological approaches and theoretical frames to ask key questions about the relationship of citizens, civil society, and the state. In the case of DeMattee's work, for example, states must be restrictive of CSOs as an autocratic move, sort of as the literature goes, but rarely is this examined over time, nor are the easing of restrictions typically studied either. Konarek adds perspectives on solidarity, not from the policy standpoint or politicians' rhetoric, but from everyday folks. Marciano formulates a framework for understanding the complex roles consultants and firms have in policy processes, which is nuance that's just heretofore been lacking. And Chaudhry and Heiss propose new ways of measuring the relationship between state restriction and civic space in times of crisis. These papers add to debates about the nature of bureaucratic violence or the ways in which the administration of care and control harms individuals and communities, and institutional betrayal, how institutions of care or oversight harm or traumatize those in their purview, and the generally complex interplay and relationship between the state, businesses, and citizens. And finally, there's the notion of temporality, or how do perceptions of and attitudes towards solidarity, the state, and human rights change or shift over time? In what ways do political rhetoric, law, policy, and on-the-ground perception shape the relationships between the state and citizenry, law and civil society, and public and private partnerships? The notion of timing, pacing, and change are key to all the papers in this particular panel, as is the notion that such things change throughout geographic space as sociopolitical and economic arrangements shift according to borders, regions, and localized ideas. And with that, I want to thank all of the panelists for your papers. I'm sorry I had to cut some of my comments short a little bit. I'm happy to follow up with anyone if you would like to email me for more information. And I'd like to go ahead and start opening the floor to questions. The first question that we have here was for Konarek. I want to ask you if this solidarity be expressed in any efforts to increase involvement of state authorities in the resolution of social problems and distresses. Among others, if in the frames of the solidarity, European states trying to improve a level of public healthcare services to create new worker places and other social topics. If you've got a response to that. And I'm gonna let someone else keep us on point in terms of time, because I'm terrible at keeping track of that. So I will let someone else sort of stop us when we need to stop the panel.
We actually have about 7 more minutes. And as you can see, I'm not great at keeping time either. So go ahead.
Great. So I will keep it short. Also, thank you so much, Amanda. This was very beautiful how you put our panel together. And I would be really also interested, maybe we can circulate the comments later. I think also for the others, it could be helpful. I will take the first question that you just read out, and also the next 2 questions in the chat were for me. And as I had a bit time now to prepare, I will answer to all the 3 of them. So the first thing was if there's any efforts in order to put the civil opinion into real policy. It's what I try to point it out. I think there's a big lack at the moment, and it's not just in a common health policy, but also in a common foreign policy. So the phenomena of the EU, and this is also how the European Union was built, and this would refer to the first quote I put, is that most of the time the policy or the institutions are lacking behind of the will of people, right? Might have to do with the fact that political decision makers have really an issue with the handing over power. So the European Union in itself is a very interesting phenomenon, because to understand that nation states come under one umbrella and are willing to hand over such key issues like foreign policy or health policy to a greater body is kind of a phenomenon in political science itself. So the answer would be that there are first approaches, and of course they all the time occur in such situations like the pandemic or an emergency situation, and then policy has to keep up with the reality and what's following. So first approaches are there, but there is still a lot of policy work to be done. The second question is from Jonas, referring to what kind of damages populism did during the pandemic, and how democratic states also can keep up with populist attempts to tackle or to use the pandemic in order to tackle democracy. So here I would say the data are maybe a bit tricky that the survey collected, because you always keep in mind that this were phone interviews of half an hour. So it's probably also a certain group of people who have the time to answer. But on the other hand, I think what we see also in the European Union among its citizens is that there are, of course, right-wingers and populists that are very much pushing against the European Union. You have it also now in France. But this is, I would say, a very loud group, but not a tremendously big group. So I think it can come from a level of the European Union to kind of trickle down, and to also kind of attack this right-wing or populist groups from a European Union level. And the pandemic, in this sense, I would say, was more helpful than destructive, because it showed that we need a global effort. Even it's not enough just to vaccinate your own citizens or the EU member states, but you have to have a global approach. And that leads me also to Peter's question, which I really liked. And I think it's good also, Peter, to have you here. And you had a wonderful input also on our first day. The study didn't ask about solidarity outside the European Union, and it didn't look into the global south, for example. It just focused on a national level and the level of the European Union. But I think this is very important, and this becomes very important when we're talking about, again, a common foreign policy and a common health policy within the European Union, that we have to look much more also on a global perspective and to show solidarity worldwide. And if not the European Union, who could be as like a flagship for this. So this is something that is really important, I think, for the future and something to push forward. Okay, I hope that was brief enough.
All right, thank you so much for answering all of the questions in the chat that were directed towards you at this time. Much appreciation. We have a question for Anthony. Is learning and emulation the only option in the global south? Or have you considered a possibility of own creativity, independent policy making? From Ela here.
Yeah, I did reply directly to the questions in the chat. Those were private, but I'll just be very brief because I know there were some other excellent papers. I think there's a really interesting idea out there that others have proposed. It's this idea of kind of a democratic facade, right? So sometimes countries will pass laws that look great on paper and then not at all enforce them as they're written. So I think that is an important dimension within a lot of these laws, that just because they pass them doesn't mean they're going to enforce them. And I think once we start to think about it that way, that explains a lot of what I'm seeing in my data with laws of like, why do they put out these great permissive provisions, but then like civil society still just gets abolished, right, and gets just hammered? Yeah, it's because governments can actually manipulate the enforcement. So I think understanding the de facto and the de jure is really important because there's going to be slippage between those unless enforcement is perfect. But we don't know what that slippage looks like, right? I mean, it could be the case that countries excel and overperform when it comes to how permissive their civic space is. But we don't know whether that's the case unless we know what the de facto is, and then maybe take a multi-method approach to and kind of narrow down our case selection and just look at particular countries or cases to understand exactly how things happen on the ground. So with that, I'll just kind of leave it. And thank you very much, Amanda, for providing such great comments.
Thanks very much, Anthony. And did that also address Nurit's comment that was in the chat as well? The question that was there. Okay, great.
So going to Amanda's question, like, can we understand these mechanisms as future avenues for more human rights abuses in the future? We think so, and that's why we're really interested in this question. That's why we've chosen to look at civil society restrictions specifically as kind of a precursor to more restrictive human rights. We have a separate paper that looks at whether human right or civil society restrictions are kind of a canary in the coal mine for more violent abuses in the future. And so we do think that kind of these COVID measures could potentially lead to that in the future as well. So that's why we're looking at kind of this lower level repression to see if it does get worse in the future. Good question.
Yeah, I'll just reply to Amanda's question about recruitment in times of crisis, and especially I've been talking to bureaucrats and service providers in the area of health. So a lot of it was about pacing the different cases that I'm doing and the different groups that I'm talking to, and trying to think about the timing when I'm approaching the different people and how they might be involved in managing the crisis at the specific time. I will also say that it has been a traumatizing year, I think. It's a strong word, but it has been a difficult year for people working in those spaces. And I've found that many of the interviews were a place for people to kind of vent and talk about what they've been through, the enormous stress of working in such a crisis. So I think that might have been it has been useful to kind of hear things in the time that they're happening, rather than kind of reflecting. That's not about recruitment, actually. That's about the interviews themselves. But yeah.
Thank you, Will, and thanks everyone to Deborah for sharing, and Amanda for the wonderful discussion points. We have another session of the conference on Wednesday, the 30th at 6 p.m. Haifa time also. It'll be the closing panel. I'm a bit biased because it's an anthropology panel, but it should be really good. So thanks everyone for joining. The panel recordings are up on our website at Minerva, so you can check them out later. And that's it. Thank you so much, everyone. Thank you. Bye-bye.
Thanks to all. Fascinating.
Bye.